femoral stems from the front. And so I think this statement is very accurate. There are very few areas in orthopedics where we have as much clear evidence as we do on stem selection and its role in periprosthetic femur fractures. So reality in the US is that we have a dramatic increase in periprosthetic fractures that we're seeing. And if we look at those, certainly at our institution, they come in pretty regularly. And so it's a common pathology that we need to address. And the incidence of periprosthetic fractures, here we are pretty far on the left side of this curve. And looking at its projected impact on healthcare in the future, it's obviously something that we need to tackle and try to prevent. And so this is what's changed. Periprosthetic fractures only 7 years ago was down here at 12% as far as diagnosis for revision or reason for revision of hip. And then here it is in 2022, it's up at 26%, only dwarfed by infection, which has also climbed the ladder a few notches. So periprosthetic fracture is a very common issue for us with regards to revision hip arthroplasty. And if we look at what's happened over the years, this is a percentage of cemented fixation femoral stems for either total hip arthroplasty for fracture or hemiarthroplasty for neck fracture. You can see it's stayed relatively constant over time. So percent of cemented stem fixation usage in hemiarthroplasty for femoral neck fracture by age group. As you can see, this tends to climb as we climb into the 80s and 90s. Most of the literature would support in patients over the age of 70 that we strongly consider cement fixation on the femoral side.